enter a crucial and difficult phase of the battle. We continue to send our prayers to the people of New York and New Jersey and to our whole country. But right now, New York and New Jersey are very hot zones, and we're with them, we're with everybody. Your struggle is our struggle, and we will beat this virus. We will beat it together. I also want to send best wishes to a very good friend of mine and a friend to our nation, Prime Minister Boris Johnson. We're very saddened to hear that he was taken into intensive care this afternoon, a little while ago. And Americans are all praying for his recovery. He's been a really good friend. He's been really something very special, strong, resolute, doesn't quit, doesn't give up. We have made tremendous progress on therapeutics. I had a fantastic call today, which I'll be talking about a little bit later. And I've asked two of the leading companies, these are brilliant companies, Ebola, AIDS, others, they've come with the solutions and just have done incredible jobs. And I've asked them to contact London immediately. They have offices in London, the major companies, but more than major, more than size, they're genius. And I had a talk with 4 of them today. And they speak a language that most people don't even understand. But I understand something, that they've really advanced therapeutics and therapeutically, and they have arrived in London already. Their London office has whatever they need, and we'll see if we can be of help. We've contacted all of Boris's doctors, and we'll see what is going to take place, but they are ready to go. But when you get brought into intensive care, that gets very, very serious with this particular disease. So the 2 companies are there, and with what they are talking about, and it's rather complex and has had really incredible results. We're working with the FDA and everybody else, but we are working with London with respect to Boris Johnson. Across the country, we're attacking the enemy on all fronts, including medical, scientific, social, logistical, and economic. We're pressing into action the full power of American government and American enterprise, and our military has been incredible. We've just sent 3,000 public health personnel. They're now deployed in the New York area, and they'll be over at the Javits Center, over at the Great Ship. And as you probably have heard, and I was informed that Governor Cuomo has already told you and announced, he called me up a little while ago and he asked whether or not it would be possible to use the ship with respect to fighting the virus. And we hadn't had that in mind at all, but we're going to let him do it, and we're also going to let New Jersey. Governor Murphy, we spoke with him a little while ago, and New Jersey is going to use it also because New Jersey is a hot spot. So Governor Murphy and Governor Cuomo are going to be using the ship, New York, New Jersey, and it's a big ship, and it's now COVID. It's set for COVID, and we are going to, hopefully, that will be very helpful to both states. The Javits Center, which is 2,900 beds, just built by our military, also is going to be manned now by the military, and they should be in place tomorrow. And they'll start sending quite a few people over to the Javits Center. It's convenient. It's right in the middle of everything. So that'll be something great. And we appreciated Governor Cuomo's really nice statements, and likewise Governor Murphy. We have worked very well with both of them, and with, frankly, all of the governors. Vice President Pence had a call this morning with them that lasted for close to 2 hours. And I understand there wasn't a negative person on the call. 50 governors, or just about 50 governors. I think they were all on, from what I understood. And they were very positive about everything their federal government has been doing for them. And you'll hear what that is, and it's rather amazing, actually. Nationwide, the Army Corps of Engineers is building 22 field hospitals. These are big hospitals. and alternate care sites in 18 states. So you have a combination of 22 field hospitals. In addition to that, we're building alternate care sites, which is a little bit of a smaller version of the hospital. And we have a lot of them, and they're going up in 18 different states. In total, we have deployed 8,450 hospital beds from federal stockpiles. And, you know, if you think this is done over a period of weeks, it's incredible, actually. More than 8,000 ventilators have been sent from the national stockpile to our cities and states, backed by the Defense Production Act, which we've used very strongly, very powerfully. So powerfully that we don't have to use it too much, frankly, and it's nice when you don't have to. We're getting more than we ever bargained for. American industry is stepping up. Manufacturers are really going to town, and we have thousands of ventilators being built as we speak, and we have hundreds that are being sent to different locations, and we're ready to roll with almost 10,000 that we have in the federal stockpile. When I say ready to roll, too, I mean exactly what that states. We are, wherever that monster goes, we're able to move with it. Great flexibility. We have tremendous flexibility, and we have people waiting, and they're ready, willing, and able, but waiting to bring them wherever it may be, if they're needed. If they're needed. It's possible that they won't be needed, that we're fully stocked, because numbers are coming in where, because of what the American people are doing, we're having fewer hospital visits. I think that could be the case in New York. It could be the case in a few other states. And fewer beds, fewer hospital visits mean fewer ventilators. So we'll see whether or not our original projections were right. But anyway, I had a very good talk with both governors, and I think they're very happy, extremely happy about the what we're doing for them, and especially going all COVID. So that'll take place almost immediately. FEMA and HHS have directly distributed 11.7 million N95 respirators. Think of that. Get the number. 11.7 million N95 respirators, 11.7 million. 26.5 million surgical masks, 5.3 million face shields, 4.4 million surgical gowns, and 22.6 million gloves. 22.6 million gloves. We have also arranged for vast quantities of additional materials to be allocated through donations and existing supply chains. We've also given tremendous medical material and supplies throughout the 50 states and territories. And through Project Airbridge, we have succeeded in bringing plane loads of vital supplies into the United States from overseas. We had an additional 3. These are massive planes, by the way. The big planes are very big, very powerful, and they're loaded to the gills with supplies. And rather than bringing them into our stockpile, as we've discussed, we bring them to all the different locations where they're needed, so we can save a big step and a timely step. Because of my actions under the DPA, I can also announce today that we have reached an agreement, very amicable agreement, with 3M for the delivery of an additional 55.5 million high-quality face masks each month, so that we're going to be getting, over the next couple of months, 166.5 million masks for our frontline healthcare workers. So the 3M saga ends very happily. We're very proud to be dealing now with 3M and its CEO, Mike Roman. I just spoke with him, and I thanked him for getting it done. And Mike was very happy to get it done. Great company. So we're getting 166.5 million masks, and mostly that's going to be for our frontline healthcare workers. Okay, that's 3M. Thank you, 3M. I also want to thank Apple, one of the many great American companies that's really leapt into action. Today, Apple announced that it is now producing plastic face shields for healthcare workers at the rate of 1 million per week. 1 million, and these are the shields that you see on television quite a bit, and they're at the highest level of quality and safety. We're grateful as well to Salesforce, which has donated 48 million pieces of personal protective equipment, including masks, gowns, suits, and face shields. So thank you very much to Salesforce. I urge all of our nation's governors to ensure that the massive deliveries that we've made to your states over the past few weeks are distributed as quickly as possible. So again, we're working very well with the governors. Now, they may see you and say, oh, we're not happy, but they're very happy on the phone. And Mike Pence is a straight shooter, and he had a great phone conversation to them with all of the governors, teleconference. And they're very happy, every one of them. Were there any negatives?
No, sir.
See? I told you. Mike is the greatest. Mike, and you have done a great job, Mike, and I appreciate it. The whole country appreciates it. Anthony appreciates it, right? Don't you? See? Everybody appreciates Mike. Special man. So a lot of the things that we've done, again, are going directly to the states. The states seem to be very happy. If they're not, they can call me directly. They can call Mike directly, and we'll make them happy. But tremendous progress has been made in a very short period. And I think very importantly, the progress has been made before the surge comes, because the next week and a half is going to be a big surge, the professionals tell us. And I think we're in good shape for it, Anthony. So it's good timing, really good timing. We can have this stuff there. It's already there for the most part, but we're bringing a lot of different resources to the various locations, especially where the surge is looking like it's going to take place. Resources from the national stockpile need to reach our warriors, and they are warriors. I tell it all the time. I saw it again this morning. These young, in many cases older, but they're walking into the hospital and they're putting on, I mean, as their doors open, they're going into this place, and, you know, it's not exactly too safe. And they're going in there and they're putting the outfits on and they're putting their masks on, and it's incredible. It's like no different than you watch the war movies or you watch the old clips of war running up hills. To me, it's the same thing. Men and women, young and old, but a lot of young people just going in there. They're not thinking about, oh, gee, this is dangerous. They're not saying, oh, I don't want to go in. They're warriors. They're running through those doors. It's the most incredible thing. It's an incredible, beautiful thing. Resources from the national stockpile need to reach these warriors in the hospitals immediately, and we're making sure they do. And again, the states have that responsibility, but we're working with the states, and we're getting the states a lot of things that they can distribute, or when they tell us, we bring it directly to the hospital from the federal stockpile or from the planes that land, without even going to the stockpile. If any state's having difficulty distributing supplies, we urge you to use the National Guard to assist in the delivery. And I have to say, you have done a fantastic job. Deborah, you know that you've done great. Tony, you know that you've done great. But what a job you've done, and I appreciate it. I really do. Your whole group has been incredible. That's a lot of stars you have, I'll tell you that. He's supposed to do a great job when you have 4 stars, right? But the military has been incredible, and I thank them for all of us. Conversely, if a state believes that it has surplus equipment or supplies, very important, because we actually have gotten so much to some of the states that they're able to now, they've done a fantastic job, and they've kept that line low. And we have some states that have surplus equipment and supplies, and they're working with us to rapidly redeploy those supplies to areas of greatest need. We thought that might happen. If it worked out well, that's what was going to happen, and it's happening. And I want to thank Governor Gavin Newsom, who's doing a tremendous job, who's announced California will send 500 ventilators to be distributed to other locations. I think some are going to Arizona, some are going to Washington, D.C. We think they're going to Delaware. We're working on that. But 500 excess ventilators from the state of California, and we're going to get them taken care of wherever they have to go. Those decisions are being made right now. The members of the White House Task Force and I are in close touch with mayors and governors and hospital administrators across our country, and we're told that at the present time, most of the critical needs are being more than met. States have to continue sharing detailed information in the amount and utilization rates of medical supplies so we know what to resupply them, or they can get it directly. That includes ventilators. They can get it directly. Ideally, if they can get it directly, but if they can't, if they're unable to do it, we have tremendous amounts of supplies, and we're building it up very fast, too. And this is before the big surge. This information is fundamental to our ability to deliver the material when and where it's most needed. Now, Mike, in his conversation today, I think got some information as to a couple of locations where we're going to be delivering large numbers of ventilators and large numbers of medical supplies, and we'll take care of that. But some of the states are very happy. Even Governor Pritzker from Illinois is happy. Of course, he may not be happy when he talks to the press, but he's happy. He's a very happy man. We're increasingly hopeful that the aggressive mitigation strategy we put into place will ultimately allow our hospital system to successfully manage the major influx of cases that we have right now. Again, I say that we're finding, because of the incredible job done by the American people, in conjunction with everybody, governors, the military, federal government, state government, local government. I've had a lot of conversations with New York City and Mayor de Blasio. I've gotten to know him. I didn't know him. Gotten to know him. And a lot of people are working hard. Everybody's working hard. A lot of people are doing a great job. I'll tell you that. A lot of people are doing a great job. But the goal is that all Americans have been sacrificing to achieve these last few weeks, things that a lot of people thought were not possible to achieve. And I think we've more than achieved, but we have to go through. Again, we're going to have a rough week. We're going to have maybe a little more than a week. But there's tremendous light at the end of that tunnel. I said it last time, said it last night. There's tremendous light at the end of the tunnel. There's so many things happening with therapeutics, with vaccines, with things that we really want. Deborah, Tony, they're all working so hard on this. But those therapeutics, I mean, look, the vaccines are going to be always a little bit later because of that testing period, but the therapeutics, getting the kind of things that I heard about today, talking to these brilliant companies and brilliant people on the phone, was fantastic. It was such an incredible conversation. And I also spoke just a few minutes ago with former Vice President Biden, who called, and we had a really wonderful, warm conversation. It was a very nice conversation. We talked about pretty much this. This is what we talked about. This is what everyone's talking about. This is what they want to talk about. And he gave me his point of view, and I fully understood that. And we just had a very friendly conversation. Lasted probably 15 minutes. And it was really good. It was really good. Really nice. I think it was very much so. I appreciate his calling. As we continue our efforts to develop treatments and cures this afternoon, I spoke with leaders of the American pharmaceutical companies, and just to give you their names, Amgen, Genentech, Gilead, Regeneron. These are four of the greatest in the world for doing exactly what they're doing. And currently 10 different therapeutic agents are in active trials, and some are looking incredibly successful, but we have to go through a process. And it's going to be a fairly quick process, I will tell you, based on what the FDA told me. And another 15 are in plans for clinical trials. So they're advancing rapidly. And today, a second company announced that the FDA has authorized its vaccine candidate to begin clinical trials. So you have Johnson & Johnson is already there. I believe they're the one that's first. And now we have a second company that just announced, and was just approved. So we have two companies at that level for the vaccine itself. We've now performed well, if you think of this, 1.79 million tests. That's 1,790,000 tests nationwide. And I think we're going to put up a screen here someplace. Good. They're on cue. They're just on cue. And here it is. This is the process starting on 5 March and ending right there, right about now, right? That's about it.
Yesterday.
So, and it's going up at a rapid rate. Nobody has done more testing. And one of the reasons why they say, and I think I can say this, Deborah, very strongly, but one of the reasons that we have more cases is we've done more testing. If I went to some of these countries that have, in my opinion, far more people than we do that had the problem, and if we did the kind of testing proportionally that we're doing, they'd have many more cases than us. But we have more cases because we do much more testing. So when you do the testing, you have cases. Otherwise, you wouldn't know about the cases. People sit home, you don't know about it. But we have now done 1,790,000 tests nationwide. That's more than any other country in the world. Hence, we have more cases. And that number is growing by nearly 125,000 people per day. Think of that one. So it's growing by 125,000 people per day. I told you about South Korea. This is a, vastly faster. And we also have, they say, the most accurate of tests. CVS is launching, and they've been great. 2 new drive-through testing sites in Atlanta, Georgia, and Providence, Rhode Island. And each location will be able to test up to 1,000 patients per day using the ultra-fast 5-minute test developed by Abbott Labs. Now they're down to 5 minutes. They call it the ultra-fast. It's very accurate. Abbott Labs, I want to thank them. They've been fantastic. We're also speeding urgent economic relief to the American worker and families and the employers. As of today, tens of thousands of small businesses have applied for more than $40 billion in relief under the Paycheck Protection Program. You've all been reading about it, and it's really, it's only been going for a couple of days. It's really been performing well. A couple of little glitches, minor glitches that have already been taken care of, what they say. These funds will result in nearly 2 million jobs being preserved, so we're taking care of our workers, small businesses and our workers. Nearly 3,000 lenders have already made loans under the program, and we're signing up additional lenders very quickly, rapidly. Community banks have been very responsive, and larger banks are also stepping up. If we run out of funds, by the way, we're already preparing because it's going so fast for the small businesses and their employees. We'll ask Congress to refill it immediately. But the banks have been great. The big banks, the Bank of America was right up there at the beginning. J.P. Morgan Chase has been great. After the first day, they really came through, and a lot of the big banks, but the community banks have been fantastic. As we announced last week, we are providing $100 billion in direct support for our hospitals. And the first tranche, $30 billion, will be distributed this week. So I want to say one other thing. Our farmers, we love our farmers. And as you know, as of April 1st, the China trade deal, $250 billion, they purchased $250 billion from us, if not more. And of that, approximately $50 billion is expected to be with our farmers. So it kicked in as of April 1st, and we'll see how it goes. It seems like they're buying, so we'll let you know how that's going. But they're buying anywhere from $40 to $50 billion worth of our agricultural product. That should have a huge impact on our farmers, a tremendous impact on our farmers, but we're watching it very closely. To fight the medical war, we've mobilized the unbeatable, and it is unbeatable, strength of American determination, ingenuity, and compassion. I got to see that when I spoke to the great science, because I call them science companies more than drug companies. They're scientists. We've seen businesses, charities, and private citizens making generous donations. So many people are making donations. We've seen states and cities supporting and helping each other and caring for our citizens. And we've seen Americans of all backgrounds and beliefs uniting together to answer the challenge and rise to the moment, and that's what they're doing. Above all, we've been awed and inspired by the exceptional courage of the doctors, nurses, EMTs, and healthcare workers who are the soldiers of this war. No words can ever express the complete measure of our gratitude for these intrepid heroes. One Cleveland patient credited his medical team for not only saving his life through their skill, but forever changing his life through their example of selfless devotion. Couldn't believe it, so generous he was with his statements. And he talked about their bravery in an area that was in such trouble, an area of that hospital where people were dying, and he talked about their bravery. Another survivor in Houston said simply, "I will consider them my angels forever. I will consider them," think of that, "my angels forever." As our nation endures the depths of loss and grief, we are also witness to the summit of American virtue, character, and courage. With the love and dedication of every American patriot, we will win this battle, we will defeat this enemy, and we will rise from this present crisis with new strength, unity, and resolve. And that's what's happening. Tremendous stories are coming out of this horrible moment, very dark moment for the world. 182. I was saying 151 for a while, and then it got up to 160, and it's 182, as I announced yesterday. 182 countries are being attacked by this virus. So I just want to thank everybody. I want to thank the American citizens for doing a great job. Stay inside, and let's win this, and let's get our country open as soon as we can. I think it's going to be sooner than people think. Things are going really well. Again, light at the end of the tunnel. And with that, I'll take a few questions, and then Mike is going to take over and talk with the Admiral and with the professionals, and we appreciate you being here. Yes, please.
Mr. President, you mentioned that you were asking U.S. drug companies to provide treatment to the British Prime Minister. What sort of treatment is that? Is that something that is available?
Well, it's a very complex treatment of things that they've just recently developed, and that they have a lot of experience with, having to do with something else, but recent for this. And they'll be, they've already concurred, they've already had meetings with the doctors, and we'll see whether or not they want to go that route. But when you're in intensive care, it's a big deal. So they're there, and they're ready. I think we have 3 of them. I spoke with 4, you know who the 4 would be. And you know the people within those. You'd know the companies. I told you the companies, but the people are the greatest in the world. So they're at the hospital, and we'll see. And they have everything with them should it be needed. Hopefully it won't have to be needed, but should it be needed. I found Boris to be a fantastic person, just like a fantastic, warm, strong, smart guy. He loves his country. You see that? I mean, he fought like hell for his country. And intensive care is big stuff, really big stuff.
Yesterday you were asked about this as well, but now that he's been moved to intensive care, does that give you and the Vice President any pause or additional concerns, steps that you're taking to preserve the continuity of government here?
No, I don't think so. Mike had his test a couple of days ago. I had my test a couple of days ago. So, and we're here, and here you are. So, no, I don't think so. But I think we'll probably, just because of questions like that, I think we'll probably have maybe quite a few tests. It's not the worst idea. You know, the system of testing now is so quick and so easy. So I could see, and you were tested again today? You sure you're okay?
I'm okay.
Good, then I'm staying here.
Despite the nearly 1.8 million tests that you say the United States has done, the Inspector General for the Department of Health and Human Services released a report today, a survey of more than 300 hospitals across the country, and the #1 complaint from those hospitals were severe shortages of testing supplies and a really long wait time. I mean, a week or longer.
And did I hear the word Inspector General? Really? It's wrong. And they'll talk to you about it. It's wrong.
But this is your own government.
Well, where did he come from, the Inspector General? What's his name?
It came from the Inspector
No,
General
what's his name?
report. I
What's his
don't
name?
know his name
Well,
off the top
find
of
me
my
his name, let
head.
me know, okay? If
But-
you find me his name, I'd appreciate it.
But, sir, these are hospitals
All I can tell
that
you
do
is
not-
this, we
sir,
put up on the
these are
board,
hospitals-
you're going to ask the Admiral, but
These are
we are
hospitals
doing,
who say that they're waiting a week or longer to get
You'll
their
speak to
test
the Admiral.
results. Why
but
is
we've
it
done
still
more
taking so
testing
long?
and had more results than any country anywhere in the world. They're doing an incredible job. Now they're all calling us, they want our testing. What are we doing? How do you do the 5-minute test? How do you do the 15-minute test? So give me the name of the Inspector General. Could politics be entered into that? Go ahead,
This
please.
is our,
Go ahead.
Thank you, sir. Are you worried about retaliation to your decision to ban export of medical goods, like Indian Prime Minister Modi's decision to not export hydroxychloroquine to the United States and other countries?
I don't like that decision. If that's, I didn't hear that that was his decision. I know that he stopped it for other countries. I spoke to him yesterday. We had a very good talk, and we'll see whether or not that's his. I would be surprised if he would, because India does very well with the United States. For many years, they've been taking advantage of the United States on trade. So I would be surprised if that were his decision. He'd have to tell me that. I spoke to him Sunday morning, called him, and I said, we'd appreciate your allowing our supply to come out. If he doesn't allow it to come out, that would be okay. But, of course, there may be retaliation. Why wouldn't there be? Yeah, please.
Thank you, Mr. President. The Paycheck Protection Program has gotten off to a confusing start for small
I don't
businesses
think so. I think it's
because
done very well.
Wells Fargo has stopped taking applications. Bank of America
Not
initially
anymore, they haven't.
prioritized taking applications from clients that were already
Bank of
borrowers.
America has
So-
been the leader, taking tremendous numbers of applications. And, of course, there may have been, they wanted to have a slightly different application. They wanted to have a little different information. But Bank of America has been a leader. They're number one in terms of applications. I wish you'd ask the question differently. Why don't you say it's gotten off to a tremendous start, but there are some little glitches, which, by the way, have been worked out. It would be so much nicer if you do that. But you're just incapable of asking a question
Sir, what
in a
oversight
positive
measures
way.
Is the federal government
It's
putting
already
in
done.
place
It's already
to
done.
ensure that there is
It's taken the
fairness?
measures. It's taken the measures. And we may even do a different system, not with this. We're going to have to probably add more money to this to save and to keep our small businesses going and to keep the employees of those small businesses working. But it's such a positive event, and you ask it in such a negative way. It just, I wish we had a fair media in this country, and we really don't. Speaking of unfair, go ahead.
Mr. President, the acting Secretary of the Navy told the crew of the USS Roosevelt that Captain Crozier was either, quote, too naive or too stupid to be in command. Is it appropriate for the Chief Officer of the Navy to be speaking this way about this captain? Is this
Well, I
the
haven't
right
heard
way-
it exactly. I haven't heard. I heard they had a statement that was made. If that were the statement, it's a strong statement. Look, the letters shouldn't have been sent, and certainly they shouldn't have been leaked. This is a military operation. I must tell you, I've heard very good things about the gentlemen, both gentlemen, by the way. I will say this about both gentlemen. And I may look into it only from the standpoint that something should be resolved, because I'm hearing good things about both people.
What might you look into, sir?
I may just get involved, if it's okay with you.
What do you mean you
Yeah,
might?
because you know what? You have two good people, and they're arguing. And I'm good, believe it or not, at settling arguments. I'm good at settling these arguments. So I may look into it in great detail, and I'll be able to figure it out very fast. But that was a statement. It's a rough statement, but look,
Reinstate him
look,
if you
look.
decide it was-
Letters should not have been sent to many people, unclassified. That was a mistake. It's a mistake that shouldn't have been made, because it's unfair to the families of the people on the ship because they get nervous, and it shows weakness. And there's nothing weak about us now, not anymore. We have the strongest military we've ever had, and we're not going to be showing weakness to anybody, because we have, that ship is incredible, nuclear-powered aircraft carrier, and we don't want to be writing letters. We don't want to have letter-writing campaigns where the fake news finds a letter or gets a leak. We don't want that. So the letter, so the letter shouldn't have been sent. With all of that said, his career prior to that was very good. So I'm going to get involved and see exactly what's going on there, because I don't want to destroy somebody for having a bad day. Okay, does that make sense? Okay.
Mr. President, Vice President Biden's spokesperson said that he made some suggestions to you about actions that you could be taken to deal with the pandemic.
He did. We had a very good talk. We agreed that we weren't going to talk about what we said, but we had a very, very good talk. It was a warm talk. I enjoyed it. I hope he enjoyed it too. And it was short. It was 15 minutes.
Did he have good suggestions? Anything that you're going to do?
Well, he had suggestions. It doesn't mean that I agree with those suggestions, but certainly he had suggestions. And I also told him some of the things we're doing. But the conversation was a friendly, very friendly conversation. Yeah, please.
Thanks a lot, Mr. President. You've mentioned, other members of your task force have mentioned, over the course of the next 2 weeks, it's going to be a very difficult time for our country in terms of fatalities. And
It will be a difficult week and a half.
And there are a number of governors who are close allies of yours, Mr. President, who have refrained thus far to have these stay-at-home orders. And Dr. Fauci, who of course is on your task force, has said that the states that don't have stay-at-home orders are putting themselves at risk and the country
Well,
at risk.
if Dr. Fauci said that, I would be inclined to call them up. You know, we do have a constitutional problem in doing that. You understand that. I mean, there's a double-edged sword. You understand. I can do it, but it is a constitutional. You can say federalist. You can say there's lots of different reasons where I would rather have the governors do it, make their own determination. They're smaller, and not in all cases, but sort of they're smaller cases. But I'm not sure 100% that Dr. Fauci said that, but you can ask him. Tony, you want to say something, please?
So I had good conversations with the governor of Nebraska and the governor of Iowa here, and it's interesting that functionally, even though they have not given a strict stay-at-home, what they are doing is really functionally equivalent to that. And we had a really good conversation with both of the governors, and when I had mentioned that, I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation, and I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing.
If I can ask a question, Dr. Fauci, before you...
Go ahead.
About getting back to normal, you said you wanted to get back to normal as soon as possible. Will we truly get back to normal in this country before there's an actual vaccine that's available to everybody? How do you start lifting the restrictions safely?
Yeah, well, John, if back to normal means acting like there never was a coronavirus problem, I don't think that's going to happen until we do have a situation where you can completely protect the population. But when we say getting back to normal, we mean something very different from what we're going through right now. Because right now we are in a very intense mitigation. When we get back to normal, we will go back gradually to the point where we can function as a society. But you're absolutely right. I mean, if you want to get to pre-coronavirus, you know, that might not ever happen in the sense of the fact that the threat is there. But I believe with the therapies that will be coming online and with the fact that I feel confident that over a period of time we will get a good vaccine, that we will never have to get back to where we are right back now. So if that means getting back to normal, then we'll get back to normal.
I think that with the therapies, and I think that with the vaccines, which I have total confidence are coming, and I'm dealing with the companies. I'm talking to Johnson & Johnson. I'm talking to all of them. I think that when you add the tremendous stimulus that we're giving, like, for instance, deductibility for restaurant expenses for restaurants and entertainment, the money that we're talking about for small businesses and employees to keep everybody working, and other things that we're frankly working on right now, which are going to be great for our people. I think when you add that to it, I think we can get more than back to normal from an economic standpoint, actually be better, but more than back to normal. But I would agree that we'd love to see a vaccine, but immediately would love to see a therapeutic. And I think we're getting very close.
Do you think you'll be able to lift restrictions on April 30th right now?
I don't want to comment on that, but I can tell you that we certainly want to try. We certainly want to see what's going on. We're doing very well. Look, you look at those. You look at most places where that, you can call it the bump, you can call it the hill, you can call it the mountain, you can call it whatever you want to do it. It's very flat. You take a look, and that was done through mitigation. That was done through a lot of good work, and that far exceeded our expectations before. I mean, people can't even believe how low some of those bumps are, some of those hills are. They're very surprised. Now, you have a couple of tough ones. New Jersey's been very tough, and New York has been very tough. They're crowded in. It's tight. It's tougher. But far exceeding. California far exceeds. Washington State far exceeds. You look at so many of these states, how well they're doing. The 8 states, by the way, and I haven't spoken to the governors, but Tony's so right. They may not have it from the standpoint that they're saying it, but those people are practicing it, and they're doing a fantastic job. Take a look at where they are in terms of the levels, but take a look where they are. So, but if I thought it was something that, and I've looked at him, and I've looked at him very carefully, looked at him today, looked at him yesterday, from a constitutional standpoint, I'd love not to get involved with that, and not from a legal standpoint, just from a moral, constitutional standpoint. Because legally, I can. But morally, I believe in our Constitution, much more so than most people. And I'd love to be able to let the governors do what they have to do. Those states are doing a fantastic job, all 8 of them. They're doing a fantastic job. So we'll see what happens. As for your question, you fully understand what I'm saying, so thank you. Yes, please.
Hi, 2 questions, if I may, one from somebody outside the room. But first, can I ask, do you think Boris Johnson, when he talked about shaking hands with hospital patients, did he downplay the threat of this virus too much? And do you know exactly what his current...
Well, I think Boris was looking at it differently. He was looking at it earlier. He was looking at it like ride it out. There were many people thinking about riding it out, meaning, whatever it is. But then you see what starts to happen, and the numbers become monumental, and they decide not to do that. We actually moved early. We moved early because of what we did with respect to the ban on China coming in, and then Europe coming in. That was an early ban, too. And then UK. No, he waited a little while, and he felt that, but he got, he made a decision very quickly thereafter to do what they did, and they've gone to a very strict lockdown. But they're suffering greatly as a nation right now. They're going through a lot. They're a nation that's having a difficult time. But I've gotten to know him. He's just such an incredible guy. It was just so shocking to see that, because you know what that means. Intensive care is a big deal with regard to what we're talking about. That's a very big deal, very scary deal. Yeah, please, Jeff.
Just somebody who can't be in the room due to social distancing has asked me to ask a question. It's Thomas Howell of the Washington Times. How many health workers in the US have become infected with COVID-19? And if the answer is not known, will the CDC be publishing that data?
Yeah, I could give you that information. I think they'd probably be willing to give that, right? Yeah, we could get you that information. Jeff, please.
Mr. President, OPEC is meeting on Thursday, and they have said that they are willing to make a cut in production if the U.S. chips in as well, which suggests that they want you to ask U.S. producers to do an
Well, you're the first
orchestrated
one that's
cut.
told me that. I don't know. We'll have to make that decision. And maybe we will, maybe we won't, but we'll have to make that decision.
But you would
I think the cuts are automatic. If you're a believer in markets, I can guarantee you there's a cut from pre this condition. Look, this happened because of the virus. The virus knocked out 40%. It went down in 1 hour. I mean, literally, when places closed up, you're talking about a 40% cut. No, I think it's happening automatically, but nobody's asked me that question yet, so we'll see what happens. I'll let you know on Thursday evening.
All right, that's the deal. But,
Okay.
but you would consider asking U.S. companies to
Well, I think it's
reduce...
automatic because they're already cutting. I mean, if you look, they're cutting back because it's market, it's demand, it's supply and demand. They're already cutting back, and they're cutting back very seriously.
But if OPEC is asking for a signal from
Well,
the
nobody's
U.S.
asked me that, so if they ask me, I'll make a decision. Okay? But again, it's happening anyway. Yes, please.
In light of all the discussion about Prime Minister Johnson and his health, can you update us on the status of the second half of your physical that you were going to have this year?
Yeah, so I had a physical. The first half was very successful. I did it on a day when I was in the White House, and we were able to do that, as the doctor reported. And I have the second half of the physical different. Probably is done at Walter Reed, and I'll do that at the appropriate time, but I feel very good, and according to the doctor, very good shape.
And can I just ask you again on the idea of a national stay-at-home recommendation? What is giving you so much pause about making
I
a
told
recommendation?
you. He understood very well. I appreciate your understanding.
It's not an
It's
order,
called
just a
the Constitution of the
recommendation.
United States, and I'd rather have, if possible, for the governors to make the decision. If a decision was very necessary, and they have done a good job, and Tony said it better than anybody, they are doing what we're asking them to do without having to put the seal on it. But I will say, if I thought it was necessary, I'll do it in a heartbeat.
Do you agree with the Georgia governor opening the beaches?
Opening what?
The beaches?
I haven't seen. I'm going to have to see to what extent. I'm going to have to see how many people you're talking about. Are they crowded? Are they packed? Are they not packed? We'll have to take a look at it. Right now, it's very early for beaches in Georgia. So it's right now very early, so I'll take a look at it. He's done a very good job as the governor. He knows what he's doing, but we'll have to take a look. It really does depend on, how crowded it may be. But I will talk to him and I will ask him that question. I would ask him, yeah, please.
KHOU Meals to 41444.
At UT Physicians, your well-being is our specialty. We are in this together and will stand side by side with our neighbors to help during this difficult
Cuts and routes. We need some flights for emergency use for military people. We need some flights for medical people. And there are very few flights, as you know. And the flights that are going out are, I think they said they're 3 to 4% full. You have 3% of the plane that's occupied. So they're very, very generally very, very empty planes. But it's good to have. It's a tiny amount of flights relative to the overall, and we need them also for medical workers. Otherwise, we're going to have to do a whole big thing with our own planes. So they're done for a reason. There's also testing done when people get onto those planes, and also when people get off the planes.
Mr. President, if I can follow up on this question of the HHS Inspector General. And by the way, her name was Christy Grimm, and it wasn't so much her opinion, but they interviewed 323 different hospitals.
Well, it still could be her opinion. When was she appointed? When was she appointed?
I'm not sure when she was
Would
appointed.
you do me a favor? Let me know.
I'll check.
No, let me know now. I have to know now, John. Let me know now. Because we are doing an incredible job in testing. We are doing a better job than anybody in the world right now in testing. There's nobody close. And other nations admit this. Other nations have admitted it very
President Trump and the COVID-19 task force giving yet another update on the response to the coronavirus. Meek Radney here with you. Real quick, let's get you a few headlines from this afternoon's briefing. To date, the president reports 1,790,000 COVID-19 tests have been administered nationwide, with an estimated 125,000 to be added daily. Also, there are 2 clinical vaccines now in the works. The president also discussed equipment production and distribution, including 11.7 million respirators issued by FEMA, an additional 55.5 million face masks each month agreement has been reached with 3M. That is big. And he shared the words of a Houston patient who referred to their medical caretakers as angels. Much more was covered at this afternoon's White House briefing. Nora O'Donnell and the CBS Evening News will pick up where we left off. That is coming up at 5:30. I'll see you back here for KHOU 11 News at 6. Breaking news, grim milestone. The U.S. death toll passes 10,000 at the start of a week that the nation's top doctor says will feel like Pearl Harbor. And tonight, a scathing new government report says our hospitals face severe and widespread shortages of essential supplies.
This is an enemy that we have underestimated from day one, and we have paid the price dearly.
Tonight, we ask the Surgeon General if we are flattening the curve and which cities are America's next hotspots. Also breaking news, British Prime Minister Boris Johnson admitted to intensive care. His coronavirus symptoms worsening. Plus, the Queen makes a rare address to the nation, her message to the world. Disproportionately deadly. Alarming numbers out of several American cities tonight. Why in cities like Chicago, more than 70% of deaths are African-American patients. Navy mess. The acting Navy secretary tells the crew of the USS Theodore Roosevelt its former captain was stupid after raising the alarm about COVID-19 on the aircraft carrier. Getting America back to work. We go inside the effort to find people who've had the virus and may have an immunity that can reopen the U.S. economy. And tonight, from online sing-alongs to social distance dancing, how families are making the most of time spent at home.
This is the CBS Evening News with Norah O'Donnell, reporting from the nation's capital.
Good evening, and thank you for joining us. We're going to begin tonight with breaking news, and it is sobering. Tonight, more than 10,000 people have been killed by the coronavirus here in the U.S., and experts say we should brace for things to get even worse before the week is over. The toll of the virus is hard to fathom. Nearly half of the deaths in the U.S. are in New York, where space to store the bodies of victims is running out. New York City is now considering temporarily burying them until the crisis is over. There is also breaking news tonight out of London, where the British Prime Minister Boris Johnson, who has the virus, has just been moved to the ICU. Worldwide, there are more than 1,331,000 confirmed cases, and about a quarter of those are right here in the U.S. Tonight, there are some signs the outbreak may be leveling off in the epicenter, New York State. But the governor there says even if the curve is flattening, hospitals are stretched thin, and he cautioned people not to let their guard or stop social distancing. There's a lot to get to, and our team has every angle covered. Mola Lenghi leads off our coverage tonight in New York City. Mola?
Well, Nora, some signs of hope, but as you mentioned, we are still expecting a very difficult and a very quickly developing week ahead. One example of that, the naval ship Comfort. It was brought here to treat non-coronavirus